Hello, everyone. Sarah Brinkley here. I hope that y'all are having a great evening. I am talking about chronic kidney disease, diagnosis and treatment from 1980 to 1989. So from 1980 to 1989, chronic kidney disease was on the cusp of research and awareness. This particular paper will go in depth on how chronic kidney disease was diagnosed and treated in the 80s. The 80s was the very beginning of a stronger emphasis on raising the public awareness of CKD and encouraging organ donations. Diagnosed patients 65 and over who had end-stage renal disease, which is also stage 5 chronic kidney disease, were being denied dialysis and or transplantation due to their age. So the National Transplant Act was passed in 1984, prohibiting the sale of organs and regulating the transplant list. The 1980s brought about a lot of study for chronic kidney disease. Due to the sharp rise in end-stage renal disease, government funding for dialysis treatment and renal transplantation became available in the U.S. After this occurrence, 1981, the American Journal of Kidney Disease, AJKD, was started and is still considered top research for peer-reviewed articles. Chronic kidney disease can be diagnosed through blood tests, urine tests, imaging tests, and removing a sample of kidney tissue. However, of course, back in the 80s, many of these tests that we do today weren't available back then. New patients were being diagnosed at an increase of 5 to 10% every year, with at least 500,000 on dialysis or on a transplant list. CKD can cause certain health consequences such as anemia, appetite loss, higher occurrences of infection, depression, and low vitamin levels, calcium, potassium, phosphorus. There are different levels of CKD, which are stage 1, stage 2, stage 3A, stage 3B, and then 4 and 5. These levels are ranked from least severe to most severe, and then stage 4 and 5 are considered more end-stage renal kidney disease, which was attributed to diabetes and hypertension. From 1980 to 1989, new cases increased from 2,000 to almost 14,000 for end-stage renal disease. This instant, which is quite dramatic, may reflect the availability of treatment, which in turn increased the number of patients being diagnosed. With the enactment of the Medicare end-stage renal disease program, over 1 million patients received life-saving treatment for the disease. In terms of litigation, before the ERSD program came into effect, few patients were diagnosed due to high cost and limited number of dialysis machines. In 1981, the Omnibus Budget Reconciliation Act, or OBRA, was signed into law by President Reagan. Public Law 9735 affected how medical payers paid for CKD and ERSD and opened up available treatment for the disease. On October 19th, 1984, the Congress of the United States approved the National Organ Transplant Act, or NOTA. It not only established the framework for the U.S. organ transplant system, but served as a model for development of other transplant networks nationwide. So it started everything, heart transplants and all that other stuff. Though the establishment of the National Organ Procurement and Transplantation Network, the law directed that organ allocation would be managed on a national basis and be developed through a unique public-private partnership. Since the initial network contract was finalized in 1986, United Network for Organ Sharing was served as the OPTN under contract to the U.S. Department Health and Human Services. So in terms of treatment, a major challenge of ERSD treatment for both individuals and society is its cost. Based on a 1987 cost data provided by the Healthcare Financing Administration, the annual Medicare expenditure for a dialysis patient was $32,000. First-year expenditures for a successful transplant patient was $56,000, but were only $6,000 for each subsequent year. These costs are not atypical for patients with serious chronic diseases. Medicare, of course, does not cover all costs either for dialysis or transplant patients. Premiums, deductibles, and co-payments must be met for other sources. So basically, here are the bullet points for the 1980s and CKD. Research was a big thing. A lot of things were found out about CKD in the 1980s through research. Awareness. There was a lot of ads that went out, a lot of journal articles, and then you've got litigation. You had the omnibus, and you had the National Registry, and you had all these programs that helped people get the help that they need. Otherwise, they wouldn't have been able to even pay for it, so they could be diagnosed. In which that brought about availability to the public. All right. I hope that y'all have a good rest of your night. I'm going hoarse now. Thank you so much for listening.